Hello everyone! Welcome to our discussion about shaving beard and mustache. Imagine these scenarios. A busy nurse finds 10 minutes of her time to offer an 80-year-old male patient help with shaving his face. The patient takes up the offer and the nurse gives him a wet shave using the hospital-provided disposable razor. He is delighted with the result and tells his wife, who visits him later that day, that he is looking like his old self again. Now, imagine that no one offers the same patient help. Perhaps his need for a shave has not been noticed. Perhaps shaving him is not a priority and no one finds time to do it. He feels neglected, and when his wife visits, she finds him unkempt and dispirited. Both scenarios may well sound familiar to many nurses. Which scenario would you take? Join me as I discuss shaving beard and mustache. For the learning outcomes, at the end of discussion, the students will be able to determine the purposes of shaving beard and mustache of a client. Assess the client in need of assistance or service of shaving, and enumerate various considerations to take before performing shaving of client's beard and mustache. Shaving is the removal of hair by using a razor or any kind of bladed equipment to slice it down to the level of the skin. This reduces bacterial growth on the face and promotes patient comfort by removing whiskers that can itch and irritate the skin and produce an unkempt appearance. Purposes of shaving beard and mustache. This improves client's appearance and self-esteem. It increases client's sense of well-being as well. Assessment. Check the condition of the skin for nicks, bruises, thin or sensitive skin. Assess for bleeding tendency. Review the client's medical history or blood test result. Consider contraindications to shaving. Shaving is contraindicated among patients with facial disorder or wound. Check if the client is using anticoagulants. As mentioned, you have to assess for bleeding tendency. Take note that anticoagulants results to abnormally long clotting time. Check the type of razor to be used. Electric razor, if available, can be used because it's significantly faster and easier to shave off growth for several days. Next is that the nurse must have knowledge on the procedure for care. Again, this is for client safety, and of course, this procedure promotes one's dignity. Special considerations to take before performing shaving. If the client is taking an anticoagulant, you have to check the agency's policy about the need to obtain a special doctor's order prior to shaving. And when assessing the drug profile, take note of the drugs that contain aspirin or drugs that are not classified as anticoagulant but may cause bleeding. Next, if you are dealing with elderly clients or geriatrics, then you must also assess their skin, okay? Often than not, their skin is thin, dry, and fragile, and their hair is brittle. So, be gentle when shaving. Shave only as often as necessary. For the end-of-life care or patients in the hospice facilities, you have to make sure that you include shaving as part of a client's grooming as indicated. Doing so contributes to sense of well-being and peace. Another one is about culture to be considered. Transcultural, okay? So, when in doubt about clients' shaving practices, consult the client or family member. You can also check the client's record in terms of the religion. Okay, so we have, for example, Jainism, Hinduism, and Buddhism. Okay, shaving is a symbol of their renunciation of worldly fashion and esteem. And another one are Jewish. again, they restrict shaving with a blade against their skin. So, take note of the religion, okay? Also take into consideration cost-cutting tips. So, although we are still on cost-cutting, we must encourage the family member to perform shaving to the client, to the relative, when acceptable to the client. In doing the procedure, also we take note of the nursing process. Okay, so we have to perform. Of course, we're done with the assessment. Now we proceed to nursing diagnosis. Okay, but then again, nursing diagnosis depends on the condition or the assessment that you had. Okay, so this is actually just an example. For nursing diagnosis, grooming self-care deficit related to neurotransmuscular impairment. Another one is risk for injury or bleeding related to the use of anticoagulant. For the goal or outcome identification, client expresses satisfaction with grooming. This is what we look forward to, okay? And that client will demonstrate a face that is clean and shaved without any evidence of cuts and bruises. Now, we have the procedures. So, this is now for implementation. Okay, so as we start, take note again of the several steps that we need to do to perform shaving of beard and mustache. First, inform the client of the procedure. This promotes cooperation and assistance. Second, wash hands. This reduces transfer of microorganisms. Third, prepare necessary materials and supplies. This promotes efficiency. Here are the materials and supplies needed for the procedures. We have electric or just the usual razor, small wash basin with warm water, clean gloves, towel, soap or soap suds, washcloth, paper towel, aftershave lotion, handheld mirror, paper lining, over bed table or side table. Provide privacy to the client if necessary. Okay, so this promotes emotional and physical comfort. Fifth, assist the patient to a semi-Fowler's or a comfortable position. Adjust the height of bed. This provides access to shaving area. Sixth, place the wash basin, okay, with 2/3 full of water. Okay, so make sure that the water has an approximate temperature of 115 degrees Fahrenheit or 46 degrees Celsius. You can make use of your elbow, okay, to check if the water is very hot or just right. And then again, this promotes efficiency of the nurse. Don't forget to line the overside table or the side table with this newspaper. Again, this absorbs water from the basin and also prevents the client from getting wet. Seventh, adjust lighting and offer a mirror to the client if desired. This provides comfortable environment for working and provides opportunity for the patient as well to cooperate. 8. Place the bath towel over the client's chest. This prevents client from getting wet. 9. Wear clean disposable gloves. This prevents the nurse from having contact with body fluids of the client. 10. Wash the client's face. Then apply wet washcloth to the face of the client for 3 to 5 minutes. This softens the area to avoid cuts. 11. Apply shaving cream or soap suds to the face with hands. This softens the area to avoid cuts and facilitates movement of razor. 12. Start shaving by stretching the skin in the area to be shaved with one hand. Shave towards the direction of hair growth using short strokes around the chin and upper lips. Holding skin taut help prevents razor cuts and discomfort during shaving. 13th, rinse the razor blade after or wipe with a tissue as necessary. This removes hair debris and excessive cream or soap to facilitate smooth stroke and keep cutting surface razor blade clean. 14th, wash off and dry the face thoroughly with a towel. This provides a positive effect for comfort and enhances self-esteem. 15th, apply aftershave lotion if available and if client desires. This provides comfort and reduces the risk of skin irritation from rubbing. 16th, remove the towel over the client's chest. Remove and discard gloves. This avoids spread of microorganisms. 17. Place the client on a comfortable position. This provides comfort and safety. 18. Clean and return the equipment to proper place. This is again for easy access of the materials for future use. 19. Wash hands to reduce transfer of microorganisms. And 20th, document the procedure. Ensure attainment of professional and legal standards of care at all times. For the documentation, this is a sample documentation. Don't forget to indicate the patient's complete name, room number, date and time that the procedure was done, and you can make use of the FDAR. Okay, FDAR format. So the focus would be facial hygiene. So data says that as patient verbalized, I'd like to shave but I'm not sure if I can do it by myself after the accident. The wife is too old to assist the client in shaving. Action: assisted the client on shaving his beard and mustache. Response: the patient verbalized comfort. And then don't forget to indicate your complete name and sign over your complete name. Don't forget as well to indicate your section and of course as your school. Now that the implementation and documentation is done, then you can also evaluate. So for the evaluation, for the desired outcome, we can say that the desired outcome has been met. That the client demonstrated clean, shaved face without any cuts or bruises. Another one, we also have outcome met as the client expresses comfort after the procedure. Here are the reference that we've used: Lippincot's Nursing Procedures and Kojiran Herb's Fundamentals of Nursing Practice. So there you go. We're done with shaving beard and mustache. Let me know if you have any questions. Thank you and God bless you all on your return demonstration.